Yemen is on the brink of collapse, and it is so hard to even get information, let alone pictures from there. We've worked with UNICEF and Save the Children because you can't go to the country to get this reporting out of the country, and it is something that we are responsible for. Just last year, President Trump vetoed a bipartisan bill that would have stopped America's support for the Gulf countries that are waging war in Yemen. And the death toll is terrifying. Already 100,000 Yemenis have died. UNICEF predicting that 6,600 children could die in the next 6 months. Even before coronavirus, few seemed to care about Yemen. Half a decade of civil war, a failed intervention from America's allies, Saudi Arabia, all allowed to drag on. Now, shattered from the horror of bombs and bullets, a humanitarian nightmare. Yemenis are in a fight for survival against a new kind of death, a silent and invisible killer. We talk about coronavirus hitting particularly people with pre-existing conditions. In Yemen, the entire country has a pre-existing condition.
You're talking about a situation where people are already poor. 80% of the population is already poor, below the poverty line.
10-month-old Amir is one of them. While the world was in lockdown, he made a 150-mile journey across the desert by bus with his mother to a hospital in Sana'a. His diarrhea was getting worse and he was losing weight, his mom, Amir, says. Amir, suffering from malnutrition, Dr. Ibn Hammam tells us, is lucky he made it to a hospital. Half already shut down by the coronavirus crisis. Many have been closed and used for quarantine, he says. They used to take care of children, perform surgeries and internal medicine. It's a real problem. But it's not just the children. Like so many around the world, this coronavirus patient is in an isolation unit. But this is rare for Yemen, not because there are few infections here, but because there are so few places for treatment and testing. How many infections there are is virtually impossible to know. Nobody is counting. But the rows and rows of graves they're digging might be a terrible clue. And it's just the beginning. Johns Hopkins figures show that 27% of Yemenis who contract coronavirus are dying, 5 times the global average.
As many as 16 million Yemenis could get coronavirus.
16 million.
16 million. So what we're talking about here is real survival by the day. They don't have water and they don't have soap. We're talking about almost 10 million people without access to safe drinking water. You can't talk about COVID and not talk about washing your hands with soap.
And yet in March, the Trump administration said it was cutting up to $73 million in aid to areas of Yemen controlled by the Iranian-backed Houthis. The U.S. Agency for International Development calling it a, quote, difficult decision. But in May, after an outcry from the aid community, Secretary Pompeo announced $225 million in emergency food aid. While for 5 years, the US has provided military, intelligence and logistical support to Gulf allies Saudi Arabia and the United Arab Emirates in their war against the Iranian-backed Houthis. Support that has had deadly consequences. In 2018, a Saudi warplane dropped a bomb on a school bus in northern Yemen. It killed 44 children. It's a war that has turned Yemen into the greatest humanitarian crisis in the world. And now coronavirus could mean catastrophe. In Yemen, the health system wasn't coping even before coronavirus arrived.
Exactly. And you have now a system where health workers aren't paid. You don't have the infrastructure. You don't have the equipment and supplies. And so what we're talking about here is sheer life and death. We're talking about grappling to ensure that we can grasp these children before it's too late for them.
The true toll of coronavirus may not be seen in medical statistics because they don't exist in Yemen, but in those lines of newly dug graves littering the landscape. A country already scarred by bombs, now traumatized by mass burials. You know, it's so important that even while we are focused on the effect of coronavirus in our own countries, that we look overseas to see what's happening and how it is ravaging many other places. The World Health Organization describing coronavirus as increasingly a disease of the poor. If that is the case, Alison, then Yemenis are poster childs for that.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.